All right, welcome back to round two. Marissa, welcome back from the bathroom. Section 2 is about Alzheimer's. So, if everybody is ready, we will begin. Question number 1, I would just like to get a definition of Alzheimer's, if anyone can answer that for me. Marissa, yes.
Well, my grandma, grandpa, uncle, they all have it. So, it's a progressive, irreversible, degenerative, neurologic disease characterized by gradual loss of cognitive functions and disturbances in behavior and affect.
Wow, that was correct. Excellent. Yeah, wow. Next question. What are 3 warning signs that a person may have Alzheimer's disease? Yes, that goes to Sarah.
Yes, that is memory loss that disrupts daily life and difficulty completing tasks at home, work or leisure, confusion with time or place.
Very good. Yes, those are all correct. Excellent. Now we have a true or false question. True or false? If someone has memory problems, that means that they have Alzheimer's disease. Sarah again. Yeah.
False. Doesn't always mean that you have Alzheimer's because of the memory loss. There are other disorders that affect the memory, such as Parkinson's disease, brain tumors, fluid accumulation in the brain.
Yes, very good. Just because you don't remember things doesn't mean you have Alzheimer's. That's correct. And lucky for Marissa, another true or false question.
Yes.
True or false? A patient that tests positive for the APOE-E4 gene is guaranteed to get Alzheimer's at some point in their life. Marissa, yes.
True.
I'm sorry, but no, that was not
What?
the right answer. We'll go to Sarah. Maybe you can explain to us a little bit more why that's not true.
That'd be false. Just because, it is the APOE-E4 gene is the strongest risk gene for Alzheimer's. However, carrying this gene mutation only indicates a greater risk for the disease. It doesn't mean that you're going to have the disease.
That's correct.
Oh,
Does that
yeah.
make sense now to you?
Yeah, I forgot.
Right. Okay. Moving along. Next question. What kind of test does the neuro doctor do to test for Alzheimer's? Marissa, see if you can.
He will do some reflex tests, with like the knee and the hammer, I think. Coordination tests, muscle tone and strength tests, eye movement stuff, speech stuff, to make sure the symptoms the patient is having aren't from another something.
Yeah, that's kind of right.
Yeah.
Okay, we'll give it to you. Moving it right along. All right, no single test can prove a person has Alzheimer's. However, the doctor will use which aspect to help with their diagnostics? We have a couple different options here. A, medical history. B, physical exam. C, mental status test. D, brain imaging. Or E, all of the above. Marissa.
Gotta go with all the above.
That is correct. Yes. Okay, we'll give you 1 point for that. Next question, another true or false question. This is an example of an appropriate nursing diagnosis for a patient with Alzheimer's. Urinary and bowel incontinence related to neurologic function loss, muscle tone loss, and inability to determine where the bathroom is. Anybody? Yes, Sarah.
True. Many patients with Alzheimer's eventually lose their ability to care for themselves and will need pretty much total assistance.
Yes, that is very correct. Okay, next question. What would be a possible patient goal for this nursing diagnosis? Risk for injury related to weakness and the inability to recognize or identify hazards in the environment. Sarah.
Yes, that would be, patient will be free of injury.
That's correct. Very good. Moving right along. To reach that goal that Sarah had just mentioned, what are 2 possible nursing interventions? Marissa, yeah.
Probably just remove obstacles from the environment, like rugs and cats, probably. You might trip over cats. You have to orient or reorient client to the environment because they get confused. And sometimes you want to put them right next to the nurse just so you can always keep an eye on them.
Those would be examples of interventions. Yes, that's correct. Okay, and we have another true-false question here. True or false? This is an appropriate example of a nursing diagnosis for a patient with Alzheimer's. Urinary and bowel incontinence related to neurologic function loss, muscle tone loss, and inability to determine where the bathroom is. Sarah?
True. A lot of times patients with Alzheimer's will lose the ability to care for themselves, so will pretty much need toilet assistance.
That is correct. Very good. Kind of going along with that question now, we have another question. What is a possible patient goal for that nursing diagnosis? Marissa?
Patient will be free of further skin breakdown related to their incontinence. You know, when they're wet, skin breakdown happens, so if we keep them dry, it's not going to happen anymore.
That is correct. Yeah, she got it. Kind of still going along with that diagnosis, as nurses, what can you do to make sure this incontinent patient is free from that skin breakdown? Sarah?
Okay, you can put the patient on a set toileting schedule, maybe every 2 hours. Bring them to the toilet even if they don't have to go, to prevent incontinence. Perineal care when they have accidents.
Yes, those are great interventions. Yes, excellent. And we have one final question here. Okay, everybody ready?
All right.
How is Alzheimer's treated? Let's start with Marissa.
Beta blockers.
I'm sorry, that is not even close. Sarah, do you happen to know the answer to this question?
Yes. It can't be cured. There's no cure for it, but there are some medications such as cholinesterase inhibitors used to treat the cognitive symptoms like memory loss, confusion. Some examples of these meds are Exelon and Namenda.
Excellent. Yes, very good. Well, that wraps up our show for today. You guys, Sarah, you did a great job, and you actually won today with 400 points. Marissa, you had 100, so that was good as well. But you are the winner of the brand new stethoscope today. Great job, and thank you for joining us on this episode.